Welcome to All Things Simplified. Today we will distinguish pericardial pathology. In pericarditis, pericardial effusion and tamponade, symptoms present somewhat the same way. The treatment is different for each, however. We need to pay close attention to the vitals and clinical manifestations. This will gauge us on what the pericardial disorder is. The symptoms include postural pleuritic chest pain, worst with inspiration. When the lungs filled with air and expands, it pushes on pericardium, creating that friction rub between parietal and visceral pericardium when the heart is contracting, causing that pleuritic chest pain. The heart is surrounded by two thin layers: visceral pericardium, inner layer; parietal pericardium, outer layer. Between them is a small amount of lubricating fluid, so the heart glides smoothly during contraction. In pericarditis, that little lubricating fluid can get infected or affected by some sort of autoimmune reaction. MC infection is viral. In this case, treatment is aspirin or colchicine. Nothing to drain, as it's the usual fluid between the visceral and parietal layers becomes inflamed and rough. Instead of gliding smoothly, they rub against each other, causing sharp pain known as pleuritic pain. Vitals in patient with pericarditis are stable. In pericardial effusion, this is same etiology as pericarditis, but with more fluid between the pericardium. If you're to place your stethoscope to listen to a patient's heart, it will be fainted or give off a muffled sound because the fluid is sandwiched between your stethoscope and heart. So the heart sound travels through the fluid to your stethoscope, will give off a muffled sound. EKG will have an electric alternans in low voltage because the heart becomes surrounded by fluid. Fluid increases the distance between the heart and chest wall electrodes. Electrical signals must travel through more fluid before reaching the electrodes. The signal gets attenuated or damped. That's why underlying cause to stop fluid buildup, for example. Same treatment like pericarditis. Remove fluid to prevent tamponade using pericardiocentesis. Tamponade is a large effusion. Patient vitals are unstable in this case, or in other words, patient is considered hemodynamically unstable. Pay attention to patient's vital to know if you're dealing with an effusion or a tamponade. Remember your anatomy. Blood return to heart through the venous system through the IVC from the body, and SCV draining the head to right, atrium to right ventricle, etc. Patients in tamponade still have distance heart sound as in effusion. However, we have JVD and systemic hypotension. This is known as Beck triad. JVD is the backflow of blood to the SVC due to blood not being able to enter the heart effectively. Status post-external pressure, which is the fluid around the heart preventing the RA from expanding or dilate to the point of collapsing the right side of the heart. This pressure also impedes heart contracting, preventing proper ventricular diastolic filling and optimal cardiac output, hence systemic hypotension.